So we started with the notion that in acute myeloid leukemia, in hotspot AML like MPM1 and so forth, we know that MRD after transplant is an important predictor of outcome, meaning then relapse in most cases. MDS, as you know, have no specific hotspot mutations. We have a band of different mutations in a band of different genes, and it was assumed impossible to design MRD markers. We show by using this method, digital droplet PCR, that it's highly feasible. It takes about 3 to 4 weeks to establish and validate an individual patient-specific MRD marker. We actually designed for all the mutations we saw in the patients, and then we assessed them by a very simple PCR methodology that could be responded to within a couple of days, that indeed MRD post-transplant is a tremendously important negative prognostic markers. So the relapse rate in patients with positive MRD was very, very much higher than in those without MRD. So that was one finding. But we also found a number of patients, this was not an interventional study, but we also found a large group of patients with a positive MRD that then was reverted. And we saw that this was nearly always associated with routine measures. Either they had developed GVHD by themselves, or they had been given DLI because the doctor was worried for a sort of imminent relapse, or by any reason they were given Azacitidine, which is the targeting the MRD is done today at the level of relapse, but we saw that this actually was the case also at the MRD stage. And we think this is very important. That means that we have to increase the measures to increase the GVL effect in MDS. And it's highly feasible to do this MRD methodology. It's not even expensive, I would say. So we have just started now a new clinical prospective trial where we actually give the MRD results to the investigator within a week from when the sample is taken. And then the doctors are free to initiate the kind of relapse-preventing treatment they would like, and which is relevant in the particular case. You can't really steer post-transplant treatment very in detail because patients are so different. But we think this is a very important and novel finding, definitely.